So good morning, everyone. My name is Vincent Andrearczyk. I am a researcher at the University of Applied Sciences of Western Switzerland. I will present our short paper on oropharynx detection in PET-CT for tumor segmentation. So I will first introduce the motivation behind this work, which is radiomics studies. Radiomics is the prediction of disease characteristics using quantitative image biomarkers from medical images. An example is shown in this image. We have MRI images with tumor annotations. We extract visual features like intensity, texture, or shape of the tumors, and we build the machine learning models to predict some clinical data. For example, the pre-treatment signature of a tumor region can be used to predict the response to treatment and survival time of a patient. In this work, we are particularly interested in head and neck cancer. It is the 5th leading cancer by incidence. Radiomics studies have been developed based on PET-CT images to predict patients' prognosis in a non-invasive fashion. However, these studies are limited by the number of available cases with manual annotations. And automatic segmentation is needed for large cohort studies and real clinical validation. So in our previous work presented at middle of this year, we had 203 PET-CT images. We compared 2D and 3D CNNs for segmentation and single modality versus multimodal. The images were cropped around the tumors to input them to the CNN, so manually cropped. But for a fully automatic pipeline, the oropharyngeal region should be automatically detected. And this is what we propose in the short paper. So this is the basic image processing method we proposed for the oropharyngeal region detection. We first apply a Gaussian filter to remove the noise and high frequencies in the PET image. We threshold the PET image to segment the brain. And finally, we extract a 144 cubed bounding box based on the brain segmentation using predefined shifts, considering that the oropharynx is located relatively constantly at the same position below the brain. So here are the results, starting with the correct detections. And a detection is correct if the primary tumor is fully contained within the bounding box. We obtained 194 out of 201 correct detections. And below are some examples of these correct detections. Now the misdetections, we had multiple images with abnormal SUV values in the PET image. These were due, for example, to incorrect patient weight or time between injection and acquisition. We also had one case in which the brain is outside the image, and since the method is based on brain segmentation, it fails on this case. And finally, we had one case with the tumor high on the Z-axis, together with the head tilted, and it resulted in the tumor not fully contained in the bounding box. In conclusion, automatic segmentation of head and neck tumor is necessary for large-scale radiomics studies. Automatic region detection is needed for training segmentation algorithms. So we proposed a simple image processing method to automatically detect the oropharyngeal region. We obtained 96.5% correct detection, and the errors that I mentioned were easily detected and corrected. And the results of this detection were used for the Hector challenge at MICAI 2020, which is currently running. Thank you.